Hello, I'm ACC CEO Jack Lewin with an important update on physician payment. The Centers for Medicare and Medicaid Services has released its final 2010 Medicare Physician Fee Schedule. The final rule includes policy that significantly cut payments for cardiovascular services. An overview of the rule is available at www.acc.org. This is not good news. The biggest cuts are related to practice expense. CMS chose to use the AMA's flawed Physician Practice Information Survey upon which to base the cuts. Because of efforts by you, many members of Congress, and patients, CMS did attempt to mitigate the impact of the cuts by phasing them in over a 4-year period. Not only cuts are phased in, but also the increases to other specialties who are not happy with us for having engineered a partial solution. But these cuts are still severe, and they simply extend the pain over the next 4 years. Nearly all services cardiologists perform will see cuts ranging from 10 to more than 40% over the 4-year period. SPECT imaging is hit the hardest with a 36% cut in 2010 alone. The reason is CMS calls this cut a new code, which would be exempted from the phase-in. Taken together, with the payment cuts cardiology has already experienced, CMS's final rule is a grave threat to cardiology practices and to patient access. By shifting services from outpatient to inpatient, the new Medicare rule will more than double the cost of the services and therefore increase the Part B Medicare premiums patients will have to pay. So double whammy, an unprecedented threat to access at twice to 3 times the cost. This is very bad public policy. The ACC understands the very real impacts these cuts will have on your practice, your staff, and your patients. The college has a 4-pronged strategy to turn this around. First, we'll submit legislation to prevent implementation. Second, we're planning legal and regulatory action. Third, we're organizing an unprecedented public awareness campaign. And fourth, we're going to mobilize members like you to help us fund and succeed in this most important challenge we and our patients and their families have ever faced. The fight has just begun. We will prevail, but we need your involvement now more than ever. Look for more information in the coming days in Cardiology Magazine, ACC News, and the ACC Advocate. Join me and ACC President Fred Beauvais for an all-member call on November 12th from 4 to 5:30 p.m. Eastern Standard Time. We'll discuss the 2010 rule and what happens next. To RSVP for the call, go to www.acc.org. In the meantime, thank you for your tremendous efforts to rally your colleagues, patients, and members of Congress in opposition to this rule. While the outcome is not what we hoped, we are being heard, and we will not let up. This is Dr. Jack Lewin. Thank you for your continued support.